Okay, I apologize there. My Zoom crashed in the middle of recording. My apologies. But we left off here talking about ALS. Um, Now moving on to epilepsy. Epilepsy is actually a very common disorder resulting from abnormal electrical activity throughout the brain, and it's characterized by having a diagnosis of epilepsy is made once the patient has multiple seizures. So there are different types of seizures. Um, when you think of a seizure, likely what you think of is this first bullet point, uncontrollable jerking movements. But there are other types of seizures as well, characterized by temporary confusion or loss of consciousness, as well as a staring spell, where the patient will just be kind of staring into space. The cause of epilepsy is unknown, but some types of epilepsy do run in families, indicating there could be a genetic component. Other potential causes include head trauma, brain tumors, or infections such as meningitis. Um, so seizures can be triggered by specific events. And there actually are some odd examples of seizure triggers reported, such as listening to certain types of music or going to a concert and being around flashing lights. One case even that I heard of reported was that whenever the patient would do math, it would trigger a seizure. So it's kind of difficult to explain uh, how seizures are triggered, but it just adds another layer of complexity to this condition. Patients can reduce instances of seizures or become seizure-free by taking anti-seizure medication. So it's just good to know what is epilepsy, that seizures can come in different forms, and that it can have different triggers. A stroke occurs when something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. And this is an emergency situation where the brain tissue is prevented from receiving oxygen and nutrients, and this it very quickly leads to death of neurons within minutes. So here's just what to look for in the case of someone having a stroke. You want to seek medical attention and act fast. So you want to look at their face. If one side of the face droops, this could be a sign of stroke. If one side of his face droops further down than another. You want to look at the arms, so ask them to lift their arms. If they're unable to lift one arm or lift it as high as another, this is another sign. And then if they have slurred speech or abnormal manner of speech. And if you see these symptoms, you want to immediately call 911. So a stroke occurs when a blood clot or fatty deposit blocks blood vessels. So sometimes the reason for a stroke is not very clear, but there could be some lifestyle risk factors as well, including obesity, physical inactivity, and binge drinking. Sorry, little typo there. Binge drinking and use of certain illegal drugs such as cocaine and methamphetamines can all increase the likelihood of getting a stroke. Stroke results in temporary or permanent disability such as paralysis, trouble swallowing, memory loss. We also went over Broca's and Wernicke's aphasia, which are most often caused as a result of stroke. So important things to know here are what causes, how stroke occurs, and what to look for in a stroke patient. Bipolar disorder is a mental illness causing unusual shifts in a person's mood, energy, activity level, and concentration, with symptoms including periods of mania, followed by periods of depression, and then followed by mania, followed by depression, and the patient is in this cycle of mania and depression. So first off, what is mania? It's abnormally upbeat jumpy or wired behaviors, increased energy or agitation, feelings of euphoria, and could lead to some poor decision making. The cause of bipolar disorder is unknown, but there could be a genetic component because we do see increased risk in individuals who have a parent or sibling with the condition. Also, bipolar disorder is more common in individuals who have undergone periods of high stress, such as death of a loved one or traumatic event, or individuals who have abused drugs or alcohol. However, this is a correlation. We're not saying that if people that undergo high stress will get bipolar disorder. It's just a correlation here. The main brain region impacted in bipolar disorder is the prefrontal cortex, and there's currently no known cure, but treatments include mood stabilizers such as lithium. So what do you want to know here? You want to know what bipolar disorder is. It's a mix of symptoms of mania and depression. And treatment is mood stabilizers such as lithium. Schizophrenia is a mental illness causing delusions, hallucinations, disorganized thinking, and speech. Patients may also experience paranoid thoughts or hear voices. Cause is unknown, again, but may relate to abnormal levels of neurotransmitters, dopamine and glutamate. We can kind of compare and contrast this with Parkinson's disease. So as we talked about earlier, Parkinson's disease is characterized by loss of dopamine neurons, whereas in schizophrenia, dopamine levels are typically increased. There is an increased risk in those with a family history, again indicating a genetic component, or exposure to toxins or certain viruses impacting brain development. There's currently no cure. So what you want to know here, you want to know what schizophrenia is, as well as the relation to dopamine. So now there's autism spectrum disorder, or ASD. And this is, as the name implies, a whole spectrum. So there's not going to be like two patients that have the exact same symptoms necessarily. But in general, this is a developmental disorder characterized by persistent deficits in social communication, in addition to displaying multiple types of restricted repetitive behaviors. And examples of restricted repetitive behaviors are repetitive motor movements, use of objects or speech, so maybe repeating the same word or phrase over and over again, insistence on sameness, inflexible adherence to routines or ritualized patterns, fixated interests, or having a fixation in sensory aspects of the environment. Looking through the literature on this topic, you'll find that boys are more likely to be diagnosed than girls, but most studies in autism have been done on boys. So it is possible that females may display symptoms differently, making diagnosis more difficult. So really, it's not very clear if this really is more common in boys or if females may just display symptoms differently. Symptoms of autism begin in the first year of life and the cause is unknown, but multiple brain regions are impacted, including the amygdala. So here you want to know that autism is a spectrum and is caused by persistent deficits in social communication, as well as displaying multiple types of restricted repetitive behaviors, and that those two factors are required for an ASD diagnosis. Narcolepsy is a sleep disorder making people very drowsy during the day and have difficulty to stay awake for long periods of time and may fall asleep suddenly. This is a lifelong condition with no cure, and the cause is unknown, but may be related to patients having loss of hypocretin producing neurons in the hypothalamus, which are important for stabilizing sleep and wake states. So important to know here is just what narcolepsy is, and the rest is just for your information. Major depression is a mood disorder causing persistent feelings of sadness and loss of interest. It's more than just a bout of the blues. Depression is not a weakness, and you can't simply snap out of it. It is a legitimate neurological condition. And we know this because we do see changes in structure to different parts of the brain in depression, such as the amygdala, hippocampus, and thalamus. Also, depression is characterized by depletion of the neurotransmitter serotonin, which we may have touched on in some previous lectures, but serotonin really helps with feelings of happiness and for giving you energy. And so because of this depletion of serotonin in depression, the treatment that's most common for patients with major depression is SSRIs, or selective serotonin reuptake inhibitors. And this essentially allows serotonin to, it essentially supplies you with more serotonin. So what's important to know here? Know that depression is a legitimate neurological condition characterized by changes to multiple brain structures. You want to know that there is depletion of serotonin, and that the current treatment strategy is SSRIs, and that SSRIs increase supply of serotonin. OCD is obsessive compulsive disorder. This is when the patient experiences uncontrollable and recurring thoughts, engages in repetitive behaviors, or both. Patients have abnormalities in brain regions, including the orbitofrontal cortex, which is associated with decision-making and feelings of reward. Causes unknown, but may be related to coping with anxiety, a reaction to stressful life events, and in some cases may be hereditary. So what's to know here is essentially the first bullet point. What is OCD? PTSD, we touched on a bit earlier when we talked about the amygdala. This is a mental health disorder triggered by a terrifying event that the patient experienced or witnessed. Symptoms may include flashbacks to, which essentially is when a certain event triggers you to recall your traumatic event. Nightmares, severe anxiety, and uncontrollable thoughts about the event. The condition typically gets better with time, but can last for months and even years and interfere with day-to-day function. The main brain regions impacted are the amygdala, as well as the hippocampus. So what do you need to know here? Just know what is PTSD, and that mainly the amygdala is involved here. And I think this is the last slide. We'll get into alcohol addiction. So long-term abuse of alcohol can damage the frontal lobes, sorry, I don't know why it's plural, impairing decision-making and cognition. It can also cause damage to the hippocampus and increase epilepsy risk. Another interesting fact about alcohol addiction is that individuals who previously abused alcohol are at a greatly increased risk of developing Parkinson's disease. So what do you want to know here? Alcohol addiction can damage the frontal lobe and other brain regions as well, impairing decision-making and cognitive function, and can increase epilepsy risk as well as risk of getting PD. Okay, so that concludes the Neuroanatomy and Clinical Point lecture for today. Thank you for listening, and if you have any questions, please feel free to reach out to me. And yeah, have fun learning.